Welcome to another edition of Wealthy and Wise Wednesdays, where I share a few words of financial wisdom to help put you back in the driver's seat of your financial future. Today is Wednesday, April 21st, and today we're going to talk about our nursing home crisis. Now, nursing homes are in real trouble, and this is an issue that we need to address, especially in the midst of a global pandemic and especially in the midst of an aging population. A recent study learned that 65% of all the nursing homes in this country, and there are over 15,000 nursing homes, over 65% of those nursing homes are operating at a loss, and 1/3 of all nursing homes believe that they will close within a year. So how can nursing homes deliver quality care if they're constantly worried about running out of money? Now, of course, lobbying groups are calling on the Biden administration to earmark an additional $20 billion for nursing homes as part of the new COVID-19 relief bill. They argue that the first $20 billion injection from last year's CARES Act, well, that wasn't enough. It was not sufficient to help these institutions because of all the COVID-related costs related to the pandemic. But here's the question. What happens if the government doesn't come through for the nursing home industry? What if there's no more money left for them? What's going to happen? Where does that leave patients? Where does that going to leave the families? In addition, finding a good nursing home is almost impossible because the information provided by nursing homes to the general public, it's designed to mislead rather than to inform. And what I'll do in the comments section below right here on Facebook, I'm going to link some rather eye-opening articles that I came across. And here's the thing. During the coronavirus pandemic, many of these nursing homes were locked down, and so they were unavailable for prospective residents and their families to actually go in and tour firsthand. So the rating system for these nursing homes, it seemed absolutely essential, pun intended. So the rating system, absolutely essential. But according to a recent New York Times investigation based on the most comprehensive analysis of the data, found that the rating system for these nursing homes is indeed broken. I'm going to read some facts and figures. I got it pulled up here on my computer. But despite years of warnings about this, the system provided a badly distorted picture of the quality of care. Many relying on so-called sleight of hand maneuvers to improve their ratings, hide their shortcomings, and all of this contributed to the disaster when the pandemic struck. Now, the rating system is run by something called the U.S. Centers for Medicare and Medicaid Services. That's abbreviated CMS. Now, it relies on a combination of a couple of things here. It relies on a combination of self-reported data from the nursing homes, self-reported, and then on-site examinations by state health inspectors. So the nursing homes receive their scores for these ratings based on three criteria. Number one, how they fare in those inspections. Number two, how much time nurses spend with residents. And then number three, the quality of care that residents receive. Now, those three sectors are combined into one overarching star rating for each of these nursing homes. And then to evaluate the ratings reliability, the New York Times, during this investigation, they built a database to analyze several of the facts and figures. They went through millions of payroll records to determine how much hands-on care nursing homes were actually providing to their residents. They combed through 373,000 reports by state inspectors, and they examined financial statements submitted to the government by more than 10,000 nursing homes. Among the Times findings were this. These are some shockers. Okay, number one, much of the information submitted to CMS is wrong. Almost always, that incorrect information makes the nursing home seem much cleaner and much safer than they really are. Shocker, right? Here's another thing. Some nursing homes inflate their staffing levels in a variety of ways, including employees who are on vacation. They're not even there. They're on vacation, but they include them in the staffing number. The number of patients on dangerous antipsychotic medications, frequently understated. Residents' accident and health problems often go unreported. And one sign of the problems of the self-reported data, nursing homes that earn 5 stars for their quality of care, they're nearly as likely to flunk in-person inspections as they are to ace them. But here's the thing. The government rarely audits the nursing homes' self-reported data. Now, the data does suggest that at least some nursing homes know in advance what are supposed to be surprise inspections. So health inspectors still routinely found problems with abuse and neglect, even at 5-star facilities, yet they rarely deemed the infraction serious enough to merit lowering the rating. Now, the 5-star rating system masked other serious problems. In 5-star nursing homes, there were residents who developed bed sores so severe that their bones were exposed. Others completely lost the ability to move. Now, of the more than 3,500, because remember, there's over 15,000 nursing homes in the United States, 3,500 are rated 5 stars. Out of that 3,500, 2,400 were cited for problems with infection control or patient abuse. And then finally, here's the real kicker. People at 5-star facilities were roughly as likely to die of COVID-19 as residents at 1-star rated facilities. Unbelievable. Unbelievable. But the most important impact may be that the nursing home industry was ill-equipped for the pandemic. Obviously, the rating system allowed facilities to score high grades without actually upgrading the care that they provided. I've got a quote here from Charlene Harrington. She sits on the board that advises CMS. And about the rating system, this is what she said. They were constantly working to improve their ratings, but not their quality. She went on to say the problem with the 5-star system specifically left those 5-star nursing homes less prepared in the pandemic. They were allowed to not have enough staffing. They were allowed to ignore infection control deficiencies. So they actually had poorer quality than the public knew about, and they were in the worst position to manage COVID. So why are these problems with nursing homes such an important issue to discuss right now? Why is this today's topic? Well, certainly, first of all, the elephant in the room, we are not out of the water or out of the woods as far as the coronavirus pandemic goes. But even looking into the future, simply consider this. There will be 140 million Americans turning 65 between now and the year 2045. So a lot of the baby boom is already there, but that's the rest of the baby boomers and then my generation, Generation X. So 140 million Americans will turn 65 between now and the year 2045. Where will we get enough money to support this aging demographic? And where will we get enough young people to work in these nursing homes? So don't you see, isn't the paradigm changing here? Won't we see family members taking on more and more responsibility for the care of their loved ones? And won't that happen more often? And won't that require different planning? And doesn't that imply that in order to have better outcomes, that family members, they're going to have to coordinate, they're going to have to communicate, they're going to have to work together. And if they don't learn how to work together, families could be irreparably harmed. Irreparably harmed. And finally, to put the exclamation point on this discussion, do you realize that some estimates say that 40% of all COVID-19 deaths in the United States occurred in nursing homes? 40%. Now, knowing these facts, would you ever put someone who you love into a nursing home unless there was absolutely no other choice? So the problem becomes that alternative ways of providing in-home care, it takes money, a lot of it. But with proper planning, we can leverage your dollars in order to provide funds to pay for the cost of the home health care, thus taking the financial burden and the time burden off of the family. I've been doing that with more and more clients, and I've been doing it for years because I believe that going into a nursing home, for the most part, it should be a last resort. It's not ideal. It's not the optimal situation. So if these topics are on your mind, whether it be for older people watching this and you're thinking about you, or maybe you're thinking about your aging parents. But if this is a topic that intrigues you, you want more information, or you just want to talk about it, feel free to reach out to me. You can message me right here on social media. You can give me a call at 248-499-9676, or you can email me at ronald.sneller@snellerfinancial.com. Thank you so much for taking the time to tune in, and I wish you the very best on your journey to health, to happiness, and to financial prosperity as well. And again, I will link those articles below here in the comments section. And again, thanks for taking the time to join me today for Wealthy and Wise Wednesdays. Take care.